Good afternoon, everybody. Thank you for joining us today. I'm going to go through just a really brief presentation, kind of talking about the benefit of going to digital charting within your ASC. And then I'm going to turn it over to Marta Schultz, who's on with us today, that's actually going to get into the application itself and give you kind of a hands-on view of what digital charting with HST looks like. So we'll cover a couple of topics very quickly. I know everybody's here to see the technology and the product, but just touching on a couple of some of the bigger benefits of moving to a digital charting platform. So, as we all know, the game has changed in ASCs. There's a number of kind of external forces that have made managing an ASC more difficult than ever, right? Increased competition and consolidation from larger hospitals, higher acuity cases being approved every year, challenges with staffing, even after the pandemic. The cost of everything's gone up and reimbursements have stayed the same. And this is really making the industry focus on proactive operations. We see the most successful ASCs are really focusing on making data-driven decisions. They're looking at all their workflows and they're doing everything that they can to automate as many things as possible and using hard data to make operational decisions within the ASC. One study that we did is this was an independent study that was done a couple of years ago. For every dollar invested in HST, ASCs achieve $3 to $6 in annual ROI. And that's something that we'd be more than happy to help anybody out that's eChart curious. We actually have a calculator that we can use that was generated by that independent third party where we can go in and put in your costs for everything associated with charting on paper and then compare that to the cost of a software license for digital charting and really help kind of make a financial case for moving to a more digital solution for charting. There's a number of kind of key themes that came out of that independent study, and almost all of it is, I don't think, going to be news to anybody, in that replacing paper with a digital platform is going to reduce time. It's going to help with compiling data. It's going to help you find the charts that aren't complete and the charts that need completion very easily, and really cut down on the time spent on chasing paper on a regular basis and be able to cut out those costs for paper and storage and labels and everything associated with that. So I'm going to talk about a couple of the key features that help drive financial success within the ASC, and then I'm going to turn it over to Marta to show you what everything looks like. So one of the biggest benefits of going to a digital chart is once that case is scheduled in your center, the chart is automatically populated from the preference card for that procedure. So no more compiling charts beforehand, no more running around and chasing paper, finding out who the physician is, finding out what the procedure is. All that's done automatically, and it pulls right from HST practice management and it automatically populates that patient's chart once the case is scheduled. We just covered on this. The charts get automatically created based off those scheduled cases. And then the nice thing is you can kind of go in there, look at the chart, make any changes. If there's implants that you're using for this specific case that weren't on the preference card, the physician can look through their orders. Everything can be done there digitally as opposed to chasing down a stack of paper. One of the other key benefits is as that patient is making their way through your center and all the tasks are being completed within those digital charting, we can actually track that patient on their journey through the center. And this can be done kind of in the back of office with relevant information for the staff. It can also be done out in the waiting room with identifiers stripped. So friends and family that have driven a loved one to the center that day can also see if they're on schedule or if they're behind schedule, if there's any delays. One of the big benefits of digital charting are the workflows that we can build in to help keep charts on track and charts fully up to date. Like any productivity tool, this can be sorted by need to do still or any outlying information that still needs to be put in charts. Administrators can look across the entirety of their nursing staff and see where they are in terms of chart completion. And then you can kind of click right into the piece that needs work and fill in the pertinent information and complete those charts on time. So one of the best things about having the digital charts as well is being able to make quick changes. If these are cases that you do on a regular basis, a case where the majority of the information, let's say 80% of the information is same every time, we've got quick charting capabilities that Marta will show you that will allow you to update that information with one click across the entire chart so that you're really only focusing on the information that needs to be added for that patient that day in the part of the ASC that they're in at the time. We can also build out templates based off a specialty so that those charts are pre-built. And again, it's kind of an 80-20 rule. A lot of the folks that we work with will use those templates and then add in a couple of custom things based off of their center, their doctor, their patients that need to be done. But instead of building from scratch every time, you can utilize a template that gets you most of the way there. There's a couple of key things just from a technology standpoint that allow you to chart faster. Being able to pin charts, most of our customers will chart on a tablet. And so being able to pin the charts that you're working on that day to very quickly navigate across those charts is something that our customers find very helpful. And then one of the nicest things, obviously something that you can't do with paper, multiple people can be in the same chart at the same time making updates. And those updates not only happen in real time, no one ever gets locked out of the chart when somebody else is editing it. Everything's got an audit trail. So when there's changes made in a chart that maybe you didn't make, but you see, you can go in and see who made those changes, what they made the change from. If for any reason we're going to adjust height or weight, you put it in at 155 and then you see it's at 150. It's very easy to go back and see who made that change and when. And then Marta's going to spend some time on reporting, but obviously the data that you're able to glean from a digital chart automatically is a huge benefit over what people are currently doing with paper and what they have to do with paper in order to get the same information. Here's kind of a short list of the over 25 EMR specific reports that you can have access to in HST. And Marta's going to jump into a couple of her favorites when we switch over here. And then ultimately, the last thing for me, and please reach out. We're happy to help with supply you with case studies. We're happy to help with introduction to references. We do have a number of stories both on the HST website, on our YouTube channel of centers that have converted from paper to chart for a number of different reasons. But a lot of it has to do with case volume and complexity and what they were able to achieve using a digital charting platform over paper. And with that, I'm going to stop sharing. I'm going to turn it over to Marta. I will be quiet now and I'll monitor the chat. So if there's any questions or anything like that for Marta, I'll be happy to call them out live. So if there's anything anybody wants to see, just plug it right in the chat there.
Perfect. Thank you,
Thank you.
Brian. Thank you, Lindsay. I'm so excited. Everybody at our team knows how much I love eChart. So I'm going to share, and I'm going to start with our preference card. So I'm going to go right here and start with that preference card because that really is the magic that happens behind the scenes. And I do like to always say this, it's a set it and forget it. So just like you might have paper chart packs that you grab and you copy to continue to make other charts, that's really what's here. Anytime I make a change to a chart, it's automatically going to be attached because I know, and that all happens on the preference card. So as soon as I'm scheduling a patient and I have the patient's physician and the procedure, I know in this case, if it's a knee arthroscopy, we're going to be doing an ortho chart. If I came down here and I said I was doing a cataract, yeah, Dr. Tisdale, I've got her. She could do everything. Dr. Tisdale, she might have an ophthalmology chart. So it all changes based on that because this is what tells eChart. It's the same database, but it says open this up. Go get that chart pack electronically and put it in place. You also can attach the physician orders. You can attach anesthesia orders. So a lot of people break those out between like MAC, general, local, etc. You can even have discharge instructions, but while we're setting everything up, I will show you once we're in the chart that you can modify charts on an individual basis too. So even though we're setting this up, set it and forget it. I've set this up. I never have to open another knee chart or OR chart over here once it's done. But I will also show you how you can make those changes as well. So this is what's happening behind the scenes. And now I'm just going to go over into eChart. So eChart looks like this because we want it to be very bright and bold for all of our clinical staff. And when we come in, we have the entire schedule right here. Now I have over here, you can see the procedure. I have a knee surgery. I have a colonoscopy. I have a cystoscopy. All of these are very different, but what chart opens is based on what we just saw in that preference card. Now, when I logged into eChart, and every time you log in or log out, it comes up and it says hello and has your name. I'm actually logged in two different places today because I want to show you that concurrent charting because it's so important. If you've ever sat there tapping your foot while somebody finishes something before you can have the chart, you should be thrilled that we have concurrent charting. But that said, I'm going to go in, I'm going to show you a couple things here, and then we're going to dive into a chart. Now, when I come into the screen like this, I have the schedule. I have search, and we're going to show you that because that's how you can close your charts or look for a chart or print a chart. I have patient locator that Brian mentioned. And so here is this patient locator, and it's telling me I don't have to look at the schedule and wonder. I can look and say, oh, Sally's ready for anesthesia and OR, and she's been out of pre-op. I set these up this morning, but Sally's been out of pre-op a long time. Ralph has been in endo, and this person's left registration, but they haven't gotten to pre-op. So as soon as I see this bright color, and you get to choose those colors. So I come from a motorcycle family. We call this Kawasaki green. If you don't like Kawasaki green, you don't have to use it. You can make those any color you want. But you have a legend across here to tell you where the people are. So this is available to every single person who's using eChart, so they know always where every patient is, how long they've been there, and you can even add notes or statuses to let people know what's going on. I'm going back to the schedule. Brian mentioned task manager, and we're going to come back to that after we do a couple of things because I want to show you that the reason we get 100% complete charts is all the pieces we put in place to make sure that your charts are complete as you go. So task manager is a way to come back and double check, but we don't want you to have to do that all the time. So if I go into Sally's chart here, and I actually have a couple pinned down here, just like Brian mentioned, we see a lot of people in pre-op and post-op using those pins because that's another way that they can kind of double check before the end of their shift. Did I get everything done? Did I check everything out? But if I go into Sally's chart here, I come in, I have an immediate screen that has information that's been captured on this patient as we go. I even have a previous visit summary that I can jump into any chart from when Sally's been here before, which is really huge and helpful. But I have this menu button so that I can go wherever I need to if I haven't pinned the chart. I can also use filters so I come in exactly where I need to be. I'm going to go to interop because there's a couple of things I want to show you there. Plus, I already had Sally coming out of pre-op a while ago. When I come in, we have certain things in our chart that we chart scope. We make sure that if you see it in one place, you're going to see it in every place. We do not want you having to double entry things, any information. So this was actually collected for Sally yesterday when they were looking at, or excuse me, earlier today when we were looking at her allergies. They're already here. I don't have to go in and ask them, but I have them available. But as I come down through, I have a consent. That's going to be represent whatever your consent is. But I see here that Sally signed it, I signed it, I'm ready to go into intra-op, and I don't have the doctor signing it yet. If I come in here to room in the patient, you can see that I don't have the consent signed yet. So I'm going to pop over here into another screen just to show you. I'm over here as Dr. Sophia Bailey. She's the doctor. Now, we do have over-the-shoulder signing, but I want to show you what happens. When I come here into Sally's chart, Sally comes in, excuse me, Sally's chart, and I'm Dr. Bailey. I came in immediately to the physician workflow. Didn't have to jump around looking for things. I came right there. I can come down to my consent. I've signed all of these other things, but here's my consent. I'm going to go ahead and sign. Now, we have this information, and this is the best part about electronic charting. If you didn't do it for any other reason, immediately I have name, title, date, and time. All those days that you're running around grabbing papers, looking for that signature, gone. You don't have to do that. The other piece I would mention is nobody was running around looking for a consent form. And I was at a facility not long ago. They brought me 3 charts to show me what their charts look like. And they were all supposed to be for the same procedure, and not any one of them matched the other one. Some there were papers missing, whatever. But and it happens everywhere. That doesn't happen with electronic chart. But you can see Dr. Bailey has signed here. I'm going to go back over here as the nurse. There's that purple that Brian was showing you. And it says, hey, that's been signed now. Take a look. You see it. And I can see right here her signature. It also put this purple here because it says you're allowed to room that patient in now. You're allowed to put that patient in a room. You have that. So it impacts not just what they sign there and you see, but anything else that might be impacted by that other person charting concurrently as you, which is really helpful. I'm going to just go ahead, and we got a late start. We were waiting on that consent. So we've got a late start here. We can look whatever the reason, we'll say it was the doctor this time, brought him in by an OR bed. I'm the person working with this patient. As soon as I review, that purple goes away. I don't have to have that anymore. So we've showed that concurrent. Now we're ready to chart. And one of the things that Brian talked about that's my absolute favorite is this quick chart. And quick chart has been approved. All of our charts are AORN certified because we start with that AORN certification. We've been through a lot of regulatory bodies with our charts. This quick chart is always approved. And the reason why is when you apply it, and I get to choose which one I'm going to use. Now I'm going to use a knee chart right here. This does not chart any patient assessments. Can't. It does not allow you to do this before you room the patient in, so you cannot pre-chart, and that's important too. But I want you to notice, like here on positioning or some other areas, nothing's clued in. But if I hit quick chart and I come here to apply, I can choose, and these are very quick. It's like less than 1 minute to set one of these up. I'm going to take this knee chart from a few years ago. If I want to see what's included in it, I can see here, oh, positioning's there, positioning aids, wound classification. Okay, sounds good. I'm going to use that one. When I click apply, it runs for just a second. And this is why we do the demo. Besides just that, we want you to see it really does happen. And now it's saying this is here. Now, it didn't automatically complete this, didn't increase my percentage here of what's complete. But when I come and I say, okay, we're going to use this supine, and maybe he's a little bit warm-blooded. He didn't want the blanket. He just wanted the sheet. I can always change that, and I get a green check when it's complete. So that, just having that ability, it was like, yep, I always use that positioning pillow there. Perfect. Yep, it is a clean. Perfect. You can see how quickly I can chart now, because those things that are not specific to the patient, but specific and need to be charted, they're there. I can still modify them. I always have to review them, but it decreases chart time. So anybody who's doing the same procedure over and over again, also known as ambulatory surgery centers, this is a huge savings for you. The time savings is unbelievable. And anybody who questions that, can we chart in that same amount of time? You don't have to worry about it. This is helping you get that. Now we mentioned we have that quick chart to help us get there. You noticed I was getting these green checks. We also have over here a completion button, which tells us what's complete and what's not complete. And these are secrets to us getting that 100% completion. And I've been working in implementations here. I've had sites 100% completion on the first day of implementation. But this comes through and lets me know anything that I haven't completed, and I have there. But if I forget, maybe I just forgot to fill something out, I can always come back to my pin and look and see what's done. Now I'm going to go back to eChart Home for just a minute. And you're going to see that Sally's appointment changed color once she went into that area. And if I go into the patient locator, you can see Sally's only been in the OR 3 minutes. So we'd have that information. Now, if you also say it's tomorrow, I can't remember, did I finish everything? I had to rush out, pick up my child, whatever. I can come here to Task Manager. Now my Task Manager looks pretty ugly, and I'm going to show you a different one just to show you. But mine is showing I have quite a few incomplete workflows. But if I click on any one of these, it will take me right to the area. So this is pre-op. If I forgot something, I can click on it. It takes me right to the status, right? And I can click here, see what needs to be completed. So again, everyone has that access to that. It runs for them personally. However, as an admin, you have this admin view and you can see everybody's. So we're using color to clue people. We're using check marks and 100% to get people on board. But this, if you did all your tasks from the day before, you get a trophy. You're all caught up and you have your information. So those couple things are really a big part of that secret behind getting everything complete. So we've made your chart packs easy. Boom, they're there. We've made it easy so that you have information. You can navigate easily through the chart. We're giving you quick charts to make sure that we're not taking more time. We're giving you task manager to make sure. But you're thinking, yeah, but sometimes they call and I need to print that chart. Right here, if I go to search and I just want somebody from today, if I click search, it gives me every patient from today. And I can come in here and if I click, I can just come down here and I can print. And when I print that, I can print that chart. So you're not held up if you need it. If that patient's transferred, they called for the doc calls and wants a copy of their complete chart. Whatever reason, it's very easy to do. This is also where you close and complete charts. So again, very easy to do. Now, I love eChart for the documentation, but one of my favorite parts about this was that certain things are standardized and other things are customized. But either way, you can report. And that's the best part about eChart to me. And so I pulled up, when Brian said my favorites, I would be here all day because I think I love every one of the 30 plus charts you get from eChart. But a couple I want to show you. I'm going to show this one first, diabetes, because this is a QAPI or QAPI, if you prefer to call it that, a QAPI study in one click. Because I've said I need to know everybody who's diabetic and did we get a pre-op blood glucose when they came? And if my facility says we do, I missed one. Yeah, got one here. If my facility says anybody who has a blood glucose over a certain level, we get a post-op level. I can look here and see if we got it. Or maybe if it's too low, did we get one after? So this report, very simple, hit and quick, gives you all of that information. So there's one. We also do all kinds of logs. So we have, and I'm going to make this a little bigger for you just so you can see it. This is another one I love. This is a specimen log. So every specimen that went out, where it went, and whether or not it's been received. And so there's a document date, the received date, and whether or not we reviewed it and said we got it. So not only can you just track, then if you have that. So those big bulky specimen logs, gone. Implant logs, gone. If you've ever had to grab an implant log book and go through it looking for, that recall, you don't have to do it. That goes away because we have reports for that. But part of what makes you successful is always knowing what you're using and how, where that is. We have, this is another favorite, this items used. I can look on a per doctor, per procedure level, what items we're using and what the total cost is per procedure. So I can immediately jump back and say, and these supplies are confirmed in eChart so that you actually use them, not just that they were on the preference card. That's why we call it items used versus just preference card. We have another one for that. But this is a great way to make sure that everything's coming and you're charging and getting noted, or if things are going up, maybe prices need to be adjusted a little bit. And so you have that. I know we're running short on time, Brian. I wanted to make sure if we have questions or if there's any certain reports anybody wanted to see, just wanted to make sure that we hit all the high points.
Marta, I'll jump in with the question. Will you talk a little bit about some of the more compliance related reports that come up? I know there's a lot of those that will have some charting parties and some hours spent building out compliance reports.
Oh, thank you. Those make me sad. The other one that for a compliance report that's coming up and that everybody's talked about for the past year is getting that data ready to send out so that you could get your surveys. It's a click. It's a click. You have your list of everybody that your survey company is going to send out and get that information back. Normothermia, and I'm going here to reports because reports are handled here in the billing side, right? But we have a normothermia report that not only tells you whose temperature was, but tells you the actual temperature, the time it was taken. And I think that's important because some people come out of the OR and they're cold that first few minutes when you get a temperature, but they're warmed up within the first 15, which would make you compliant with normothermia. So that's another one that you have to send. Again, all of these logs, your CLIA log, your in-house lab log, all those help you with your compliance. Those QAPI studies, here's one for BMI. Everybody has a limit for what they'll accept, but when they get to your door, is it really what they weighed? I'll lie about my weight. I can't be the only one. So that's another report that I love for compliance and to making sure that we're following our own policy. So tons and tons of those, Lindsay. So great question.
Awesome. And then another couple more just came in. So the first one, can you set up multiple external groups in order to have one module that shows all particular provider surgeries that are scheduled?
Yes. Yeah. You can do that through reporting. So through reporting, you can look at that. And I want to make sure I understand the question. So are they asking to have like one chart that's for everybody, or?
I think it's like a view for one doctor and all their cases.
Oh, perfect. So right here, if you notice, I've got a lot of cases on here. Now, if I'm working in OR1 today, I can filter here and I can just say, I just want to see OR1. And this is my personal view, right? So I'm seeing that. But as a physician, you might have noticed I'm over here is Dr. Bailey. If I go back to eChart Home, even though I have those other ORs, I'm only seeing my own cases today. Now that is configurable per facility. I've had a few that want it, but for most surgeons, they don't want all the noise on their chart there. If they really want to see where everybody is, they can click the patient locator. So nice. Yeah, thank you. Good question.
Another one, this one's a little bit more specific. Can you please show how to add additional supplies used during surgery?
Yes. Oh, yes. All right. So I'm going to go back here as a nurse because we don't expect Dr. Tisdale to be doing that. That's not going to happen. We all know that, right? I'm going to go back to Sally's chart just because I was in there. And I'm going to go back to the intra-op area. And I'm going to use a supply that's also an implant because whether it's a supply or implant, it's the same deal. If I come here and I go down to my implant log, well, I'm going to go here first. If I come down here to supplies used, these are my supplies that were on the preference card that I expected to use. If for some reason, now I have a bear hugger and we said maybe Sally wasn't cold and she didn't need it, but if she did need it, I can just come here and edit it and say, yep, we did use that bear hugger. Now, if I had filled it out in the bear hugger block, it would have already came here. But one is the implant. And I'm going to go down here. I have some screws that we're using on this knee, right? So I have this screw. They're fairly expensive. I'm going to go to that implant log because you saw that it was one there, but I don't need to change it there all the time. If I'm here and the doctor says, ooh, this knee's really messed up, I need 3 more. So I'm using a total of 4 today. So I did that while I was working with the implant. I have that information. Implants are there. I just want to show you when I go back to the supplies used. And notice I'm using that little completion button to move around. Most people will scroll with their finger on a tablet or they'll use a stylus. But if we come down to that screw right here, it says 4. It says 4 there. So and then that goes back over to your inventory so that you know that you use 4 and you have 4 less than you had 3 minutes ago. So does that help, Lindsay?
Yeah, perfect. And right at time, I know we're just a minute over. Thank you all for joining us. As mentioned in the chat and then at the beginning, this is recorded. We'll send it out afterwards. If you want to see something that's more customized to your workflows, every surgery center is different. The product does a lot. We could spend, as Mark said, spend the whole day just talking about the different things there. Reach out, whether it's through our website or through your AE, or you want to send an email over to us. We will happily get you on the right path so that you can see how it will fit for your unique needs. Someone just asked, just because we're here and it says anonymous, who can I set up a billing demo with? Because it's anonymous, I can't follow up with you directly, but if you want to go to our website and submit a form, we'll get you right down the path and we can do a deep dive on that one as well. Thank you so much, everybody. Have a great afternoon.
Bye. Thank you.